Once again in Diamond Diagnostic Center, we solve all your health problems such as prostate problems, infertility, you've been married for so long and no fruit of the womb, low sperm count, stomach ulcer, fibroid, liver and kidney problems. If you have all these problems and more, do make a date with Dr. Marina on Health Solution
for deep medical science facts and home remedy.
Mede de Mary, in February na high pressure ba me so ye BP. But she sa me nya no adu na nsa ya na me mane hu se Dr. Marina. Eye program wo TV so na mo ka kire me. Na mo de me call ho busu me ni a Dr. Marina treat me. BP adien yo me ntin kan biem. Metimi ye BBM timi di adwane bia me penti me kan fo se wa wo sa BP bia na high pressure wo so no. Emfa nko ba bia Dr. Marina na ye last stop. Mo nyina mo nko na mo nya mayaresa.
You can contact us in Accra on 0202 112 866 0243 176 119. In Kumasi, call us on 0267 018 289 0207 515 623. In Takrady, call us on 0558 294 804 0548 705 543. And in Tamale, opposite Kamina Barracks, behind Second Star Oil Filling Station on the Bolga Road. You can call us on 0500 022 853 0558 294 091. Diamond Diagnostic Center, your last stop in medical services.
We are continuing the cycle about the diseases which is very common, but it is not popularly diagnosed. Today we will discuss about the liver disease, and the name of that disease, it is a cholecystitis or calculocholecystitis, that it is a disease which is just affected liver. Let's look and see what is the function of liver. We will discuss and ask about liver function our MPhil specialist on the pharmacology, Dr. Joshua Santi.
Yes.
Doctor, what is the function of the liver? And we discussed today about the gallbladder. What the liver doing and how it is just give us what is the points and function in our body.
The liver is a major organ in our body. When you asked about the function, it has a lot of functions. The major ones are what I will just mention. It is involved in detoxification. When we mention detoxification, that when we take things that are toxic to the body, it is the liver that helps to reduce its effect. Number two, the liver helps to produce digestive enzymes. This is bile, which is helping to digest fatty acids and oils from the diet that we take. The liver is like the energy house, helping to produce heat for our system. And then its major function is also involved in drug metabolism. That any medicine that we take oral is going first into the liver. The liver is going to work on that drug and change it into another form to make it more toxic or to make it less toxic for its effect. So it is involved in drug metabolism.
It means all the drugs what the people taking is just straight going to liver, and liver is just selected. Or it is going to be good to the body, or it is going to be bad to the body.
Yes.
Poisoning or not poisoning?
Yes.
And if it is poisoning, that the liver neutralize the poison.
Yes. One function of the liver is what we call amino acid synthesis and conversion. The liver produces enzymes that is involved in the amino acids. Like we have the aspartate transferase enzyme, and then we have the alanine, which is involved in amino acid conversions. This is one major function of the liver.
That the doctor explained to us that the liver has a lot of function. Number one, it is selected everything what is entering into our body for the toxins or not toxic. If it is a toxic to us, liver just supposed to neutralize the toxins. If it is a good for us, liver just selected that it is good and just put to another way that it is good for the body to absorb and push into digestive system. Second point, the function, it is just liver producing enzymes. It is some of the substances which is helping break down the oil, break down the food and prepare it to digest. The third function of the liver, it is helping with the blood circulation system and neutralize some of the red cells which is pass their function through the bloodstream and enter in there for neutralization.
Yes, yes.
The next function of the liver, it is just producing fatty acids, non-fatty acids and fatty acids, which is making control for our elasticity of the blood vessels, elasticity of the cells membrane, and elasticity and function of our brain cells inside in our head. That this is a control. This is just generally we discuss about the function, what the liver doing.
Yes, and
Now-
it is also involved in cholesterol.
No, this is I tell the substance
Yes,
is
the
about
fatty-
elasticity.
yes, elasticity.
This is like everybody going to the lab and want to know their cholesterol.
Cholesterol level.
And the cholesterol, how we discuss, it is just the substances,
Mhm.
that oily substance, the type of the like lipoproteins.
Yes.
And that proteins is just helping to have elasticity of the blood vessels. And we have a good cholesterol and we have a bad
Bad
cholesterol.
cholesterol.
Good cholesterol, it is helping good food from the liver just and from another organs to take minerals, substances and everything to bring to that cells where the energy is supposed to be produced and metabolism inside in the cells will be produced. And the bad cholesterol supposed to from that side take the waste and bring to the liver to neutralize. This is if we are just detect and see like good cholesterol is going high, it means it is good.
Yes.
That we have enough substance which is supply the good energy and good minerals to our body. But if the bad cholesterol, it means with the waste, which is toxic, which is unnecessary to our body, going high and they couldn't enter to the liver to neutralize and just break it down, that they start keeping inside in our blood vessels, inside in the organs, make fatty liver, fatty heart, fatty kidney. This is like a fat. And the second point that cholesterol is entering to the blood vessels and develop cholesterol plaques, which is making blood vessel narrow and the blood couldn't flow normally. When the cholesterol plaques is just develop inside in the blood vessels, it is make some of the points where the erythrocytes, this is a red cells, which
Yes.
is flow inside. They are touching that piece and start make it thickness and develop the blood clots,
Yes.
which is called thrombosis.
Yes.
And that thrombosis breaking the way to the blood flow normally and cause how the people telling for our brain it is just like a stroke or brain infarction because the blood is couldn't flow and it is breaking the way that brain doesn't have enough supply of the blood and the cells start dying. This is we have like necrotic changes and we are, it is caused like a death of the brain. This is like we discuss about the liver function and now from liver we are coming to the brain, to the stroke, to another points and even the liver connecting to the heart issue.
Yes.
Because the strain
high
it is
cholesterol can cause
how
stress.
I hear that if the heart is not functioning, that the liver pumping the blood. This is how it is. If they stop the heart functioning, that the liver with the small cycle of the
Microcirculation.
circulation, the liver is taking that blood and just pumping and continue and keeping the life of the people.
Okay.
But we discuss about the bile, that how the bile is just affected our body and how the gallstones is developed.
Okay.
This is that we discussed that liver, it is just has the two lobes, one on the right side, one on the left side. But the gallbladder is located just on the right side in the middle. And if the bile, it is just always producing with the liver.
Yes.
And the gallbladder, it is like a sac, where the bile is just keeping inside.
Yeah.
If we are not drinking and eating enough, that the bile is stop producing. This is a one way. The second, when the oily food is entering to our stomach, the bile is supposed to pump in enough bile secretion to break down the oil, and that jollof and oily food and our granule soup and palm soup and all the food which is contained the
well
oil
digested.
to break down the oil. If it is bacteria entering inside, like typhoid, for example, breaking the way, and the bile is not coming enough, it will start develop like congestion inside in the gallbladder start develop.
Okay.
And that congestion is just create and develop gallstones, that bilirubins inside in the bile, it is not washing well, and calcification, crystallization start develop.
Yes.
What is the symptoms of it?
Spasm.
Spasm. The pain.
Pain.
The pain.
On the right side.
Some of the people, if the stone is just trying to enter in and pumping out, it is blocking the way for the bile duct. It is just blocking the way and making a spasm that the people start feel like severe pain here, especially after the food.
Yes.
Some of the people don't have that symptoms, and they start feel like pain in the on the right shoulder.
Yes.
If you feel like your right scapula and your right shoulder is just paining you, you need to take attention
And
and
sometimes giving pain on the right side.
this is what I'm
Yes,
telling that
on the
the
shoulder too.
right shoulder, it can be right neck, it can be just right side. Some of the people will complain that full right side of the body is paining.
Yes.
This is can be a result of that spasm inside in the gallbladder and development of the bile secretion is not coming
Yes,
enough
and
and
the
the
stone.
gallstones. How we can detect it? The gallstones.
Investigation through laboratory test and scan. Okay, when the patient is coming, we are given a request to go to the lab to run some laboratory tests.
Which of the lab? Mention please.
Most important, you do full blood count, you do urine test,
Okay.
then you do liver function test,
Liver
and
function.
lipid profile.
Okay. All of them will show. But if it is a gallstones, it is some of the parameter. I know like
Alkaline phosphatase.
phosphatase.
Yes,
Phosphatase alkaline,
Yes, it's
which is
usually
just-
going up.
which is just elevating up. That parameters is show
Yes.
that your gallbladder has a blockage, and take attention that maybe the gallstones is developed there.
Yes.
But when it is happening, you need to take attention that your liver will start grow bigger. Your problems, because the oil is not breaking
Yes.
very well, it is develop and create like fatty liver.
Yes.
And that fatty liver, it can be indicate not only the problem with the this problem with the gallbladder. It can be a problem like fatty liver, it can be hepatitis, it can be liver
Yes, liver
diseases,
inflammation.
toxic
Yes.
liver, and a lot of points what is just indicated.
Yes.
If you have enlargement, this is why necessary. Come to the hospital to do laboratory
And then
test.
another issue, you see, this bile is supposed to help break down the
The
oil, okay, and it is not coming. It means you have a lot of oil staying at the upper part of the stomach, and then there will be increase in what? Acid.
Acid.
Hyperacidity.
It
And
will
then
create, in
cause-
this case, it is called the ulcer.
Very
The
good.
stomach and duodenum ulcer, it is result of this problem with the bile spasm.
Very good. And
When
then
we
the
have-
jaundice, when the stone is blocking the bile, it is accumulating.
No way for the bile to come out.
To come out,
It
it
is
is
going
going
to the blood.
into the bloodstream, and it can cause itching of the skin. Sometimes they feel like they're pinching and aggressive, because this bile is a chemical which is very aggressive. If it goes under the skin, it is causing itching.
Okay.
You can see
Okay,
yellowing
we
of
just
the
let's take attention to our viewers
Yes.
that if you just start feel like you have a itching of the skin, start from pinching, then you start feel itching, and especially if you itch and scratch and it is a red lines is coming.
Yes.
It means you need to take attention for your liver conditions.
Yes.
It means the jaundice can be created and developed.
Yes.
After a few days, you can see like the eyeballs changing the color, and from white color it is start like a yellow,
Yellow.
and I saw some of the lady even with the green. I know
That is very
how
serious.
how many bilirubins is inside
That is so serious.
all the vials came to the eyeballs.
This is so serious.
And the people can even open their mouth and
You
see
see
it.
yellowing of the tongue and even the palm sometimes.
No, I know that if it is liver problem, that they have some of the red lanes here, like a red star on the palm is just start coming.
Yes.
Itching of the palm and that red star is coming on the palm. It is indicate that on the Chinese diagnosis, it can be indicate that you have some liver problems. Which of the disease with the liver, come to our facility and we will help you to detect and diagnose.
Yes.
Thank you, doctor, that you explain everything. But the solution, what is the solution for this condition?
Very good. The solution, you see, we first talked about the function of the liver, that everything we taking in orally is metabolized by the liver. Therefore, we have to be careful of what we eat and the medications that we take. In our center, we prepared a special alternative medicine, which is natural. First, when you come, we investigate to find the cause. Is it pathological infections that you have? Is it blockage that you have? Or what is the cause?
Or it is a spasm?
Or it is the spasm. Then we give you medicine naturally and advise you on the diet, what you need to eat. You stay away from too much oily foods and these palm nut soup and groundnut soup, which are
No,
heavy
this
for the
is
liver.
just, it is a shock for our viewers because most of the traditional food, it is based on the pepper and oil.
And palm oil and palm nut.
Red oil, it is everywhere. It is just based on
Yes,
the
but
diet.
what is very good for our viewers and the good news that we have for our viewers is that irrespective of the cause, if your liver problem is as a result of hepatitis, we have the special medicine for the hepatitis and to improve your immune system. If it is the fatty liver creating a lot of bad cholesterol, we have medicine to clean your blood vessels and medicine to cure the liver. We have the liver tea that even if you don't have liver problems, you can come and buy and prepare to take every morning to protect your liver from all these dangerous chemicals. Because we live in an environment full of infections and chemicals and medications.
Yeah, this
which
is
we
like
can't avoid.
this malaria is very frequent.
Yes.
And all the malaria parasites and
They attack
plasmodium
the liver
attack
cells.
the liver.
Yes. So we
And
advise
necessary to
protect
regenerate
the
the
liver
liver
cells.
after the malaria.
yes.
Then if they have some of the people who has hepatitis, they just can take that tea and clean the
Blood vessels.
blood vessels and the liver itself, regenerate the liver cells, hepatocytes,
Yes.
that they have like hepatoprotective effect. This is that liver tea. And the medicine which is just like a clean west to clean the blood vessels from the bad cholesterol
Yes.
and boosting the good cholesterol to functioning and give a lot of function and good impact to the body that you stay healthy in a short time. 2-3 months and you forget about your problems and you can eat everything again and create the disease. It will pass like 10 years or 20 years, nobody knows how long, only the God knows.
Yes. So we are calling and inviting our viewers. You can tell your friends, you can tell your family members to come to our center to check the status of your liver. And if you've been diagnosed with liver disease, just come. We have a special treatment for your liver and to keep your system and your body in the good condition. We are welcoming you to our center. In Ghana, you can locate us in Accra, East Legon, Oponglo traffic light, just opposite the Legon University Sports Stadium. Kumasi, you can find us at TUC Junction near Santase Roundabout. And then in Takrade, Anaji, opposite St. Peter's International School. In Tamale, you can find us behind the Kamina Barracks, opposite Star Oil Filling Station. You can also go on the internet, www.diamedghana.com. YouTube, we have the Diamond TV. You can also call any of the numbers on the screen for further enquiries or questions. In Nigeria, you can find us in Lagos, Victoria Islands.
32A at the Tecumba and the Mola Street.
We invite you with your chronic conditions for alternative treatment. And
Mr. Media ne situ yare. Me de Chinchin Hospital wo do bebre wo Ghana ha. Me nya yaresa. Na madam for be na chere me dami hospital na me ko hu Dr. Marina. 3 weeks ni nyame no kure ni moma yenka. O start share me a me san call check up. Aba normal. Into baby a wo tie me all hwe me wo fie. Se onto na namo no onko hospital wo na ne yaresa ebeto no.
You can contact us in Accra on 0202 112 866 0243 176 119. In Kumasi, call us on 0267 018 289 0207 515 623. In Takrady, call us on 0558 294 804 0548 705 543. And in Tamale, opposite Kamina Barracks, behind Second Star Oil Filling Station on the Bolga Road. You can call us on 0500 022 853 0558 294 091. Diamond Diagnostic Center, your last stop in medical services.
And they are promoting and changing my the bread will not effort. Ye liver, now say your bread will a young yet to match a boom, Yalia Potia, your friend, cholecystitis, and now say gallbladder stones. The Dicano, ye betcha ye bread bone, you may dear AD, say bread bone, you may be breed. I say a organ son, where we nip a grimoire, a bois, a you would a fee, a we nip a grim, a year for the shine. I feel so. Near ma, a word pepper in nip a grimoire, a hair toxin, and answer in your many pepiano. The bread bone on a bois, a brenner say. I feel so a CSC, a pusu be a your friend back. Na Sabali, a court, your digestive system, a conane and one, a beer, a way be near your deal. I just say a bread bone, it did you a dear son, and my nip a piano. Your boss was said, your bread bone CSC, bono, your friend bar. Na a cuckoo, na quay via your friend bladder, I had to say a sack, a kutuku, na sa bono not for a baby. Say you nip a beer, and now say your digestive system, no, a here, sa bonunia, na gallbladder, no, a piano bonuno, they are caught, ye digestive system, netting and a neck, and why do you be a yeti? Or how a buy your gallbladder more? A fay not a bonuno can was a pea, a call your digestive system into me. A bit to me, I infections. Say a more one getting kitty a young fire new and a pepper betna sa and a mono na a fay at the blockage about a nutty into me mats are bonuno. Na a chassis a crystallize and I say a yet the den are your gallstones. Yes, I pay a division sounds of one neighbor in Niperia. To do on my Betty and say, Nilifa so in Fimuho, who bet or tea yaw cassia or pine woman there, Johnny. I feel so bit my call, na Betty, I call the con or on my debian, Nifana the Enia, the con Nifana the Enia, and I send him fin. Also, 2 and a more, a bit me, I a gallbladder, and I how I had a yapam. I feel so say, gallbladder, no, the bono, say, intimate fan copy, a bit mamma said a dorsal, or your phone no swap, and also bit me the all saba. I feel brebo to make the nusu and sisu ya, a timima ye and what ye cholesterol, and so cosra, bit me the hypertension in this stroke, brabro. And into your bread war, and the sad gallstones, ya can was in now a moon here said, ye be 2 1 more. If he said, so what now, now you could do sape, you could you go blood and the flu on one. Not just I'm webbing and growing to me be a was as he saw. A bema was sitting a bear, was in 10 years 2 and south flow. You were drawn from qua, or by a slay and who says, how no now, ye de be ma obesiesie wo brebo ne wo gallbladder yi stones ni nyina afiri ho e clean wo blood vessels no ama wo honam na kwa ni nyina asisi so pepepe obi wo no ho se ne ho keka no yes, I bonno no bar no and the corn ne radio no ase e ma no ho etete ne pepepepe ni nyina no ba ne ye hwehwemu a ye behu ne ya moduro asiesi onipedua no ayi ni nyina efi ho Diamond Diagnostical and Treatment Center ya so ya bepie Ghana manmu a emrofo doctors ene Ghana doctorfo a obeba ye be ye onipedua mu hwehwemu ehun yare ne ne fare by near to as ya ma say your kidney disease and our liver problems now ulcer infertility problems prostate mu how kotodwe anase kase mu how na wo when arthritis ana oba when fibroid now they anante unya no adura to anamo bra diamond ye no operation ye be mu aduru ama ni nyina ye dey efri ho ubehu ye wo Accra East Legon ne Legon University Sports Stadium any dear Nimshe, Kumasi, Ubehuya or TUC Junction, Ben Santasa roundabout. I feel so Ubehuya or Tamale, behind Kamina Barracks, Star Oil Filling Station, Takrade, Yawanaji, Opsi St. Peter's International School. Fawyari out the Atlantia Union Road, Ebra Diamond, not your last stop in medical services.